All right, Secretary, thanks so much for chatting with us for a few minutes about the SNAP programs. Kind of let's talk about the background of SNAP and Medicaid and how that is used and impacted for folks here in North Carolina.
Yeah, it's great, Rod. Thank you for having me this afternoon. Well, Medicaid and SNAP are both critical programs in the state, particularly for helping the most vulnerable citizens. Medicaid provides essential medical services, prescription benefits, and other necessary medical care for almost 3.1 million individuals in our state. And similarly, to balance that, the SNAP program reaches about 1.4 million, and that program is largely focused on nutritious food for those who are unable to afford it on their own.
And for people who may not be familiar with SNAP, kind of just describe what that is.
Sure. So SNAP stands for Supplemental Nutrition Assistance Program. It's a federal program. It's a partnership between the federal government and the state government. And throughout history, the food portion of it, the food benefit, has actually been provided by the federal government. And then the state and the county share in some of the administrative cost. So not only does it reach as many people as I said it does, it's financially a very beneficial program for the state because it meets a very critical need.
And so, for these changes that are coming down the pipeline, possibly, what does that mean for people in North Carolina?
Yeah, well, let's talk about the SNAP program first. As I mentioned, it's 1.4 million individuals. On average, that's $5.70 per person. And so it's not a lot of money when you think about it,
Mhm.
but it's absolutely essential and critical. There are eligibility requirements. Counties help determine the eligibility based on standards. And then the program is made available to those who qualify for the program. Right now, it is, as I mentioned, federally funded. Some of the proposals that are coming out are looking to shift some of that federal burden to the states. And our state, as you know, is already in a pretty tight situation financially. And depending on how the program plays out, it could be anywhere from 140 million to 700 million dollars more a year that the state would need to find if it wanted to continue providing the service at the current level.
So, for people who depend on that SNAP program, if these cuts come to fruition, what would that look like for them?
Well, it's critical. For right now, what the SNAP program then means is there's whatever limited resources there are, since it's not being allocated to food, you have it available for things like fuel, energy, rent, and other essential services. What's going to happen is individuals are going to now have to balance: do I pay the heating bill, or do I pay rent, or do I eat? So it's a pretty precarious situation if these benefits go away.
And I mean, we're talking, million plus people here that this is going to have an impact on, and that burden of financial burden then shifts to the state. And as you mentioned, the state's already kind of strapped itself.
Yes, most definitely. And when you kind of think about those who are most impacted, it's the rural communities, most vulnerable individuals. We've seen an increase in SNAP benefit utilization in the western part of the state for those counties that have been impacted by Hurricane Helene, veteran population, disabled. So it's magnified in some ways because when we talk about the vulnerable population, it's the most vulnerable among the vulnerable.
So, what's the call from the health department to federal government leaders, state government leaders?
Yeah, our goal is to do exactly what we're doing right now, is to have these kind of conversations and then have individuals reach out to their local elected leaders on the importance of this program. And then, because so much of this is being decided at a federal level, reach out to your local congressperson, let them know why it's so important. Reach out to your US senator and let them know how critical the program is. One of the other interesting things about this, Rod, is that the SNAP program actually generates somewhere around $2.8 billion to the North Carolina economy. So it's not just a program that actually meets that need, but there are about 9,200 local retailers, oftentimes local shops like the ones we call mom and pop kind of shops that actually will take the SNAP benefits. So they're dependent on those revenues coming in order to meet their economic objectives. So the downstream impact is just not on health and hunger. It's actually an economic argument as well.
Yeah, I didn't think about it that way. As far as Medicaid is concerned, what would that look like if those benefits change?
Yeah, similarly, there are proposals that are being made to think about work requirements. And right now, our best estimates that when you take those individuals who are already working and on Medicaid, which I think many people don't actually appreciate in terms of understanding that there are many working individuals who actually are Medicaid beneficiaries. When you look at those individuals, disabled, children, as well as the elderly. It's only about 8% of our population that's currently on Medicaid, 8% of that over 3 million that may qualify for work requirements. And so I think it's important to understand that it's actually a fairly small percentage relative to the entire size of the program. And so if there are work requirements that are being imposed, one of the things we've learned from other states is that it's a lot harder to do than it sounds, because the eligibility process and so forth can be fairly laborious. And finally, this work falls on the counties. And so our county DSS agencies are already stretched thin with vacancies on the labor side, increasing costs and so forth. So this would be an additional burden on an already stretched workforce. So that's one part of the Medicaid program. And real briefly, the other piece that's under consideration is this process called redetermination, where every so often an individual is redetermined to be eligible for the Medicaid program. And we do that annually. And annual redetermination really identifies those individuals who maybe shouldn't be on the program. And sometimes we actually identify individuals who need to stay on the program or maybe haven't qualified. What ends up happening, unfortunately, if you do more frequent redetermination, it's that same group of individuals that I mentioned at the counties that are already stretched. And it's not clear if you're going to actually identify more ineligible individuals through more frequent redetermination. So those two things, the redetermination is up for play in terms of frequency, as well as some of the other stuff I talked about with respect to work requirements.
What would be the best course of action, in your opinion, for this? I mean, I think everybody can agree that there's probably needs to be some sort of budget cuts, because systems can get bloated. How do you do that and still preserve the integrity of these programs, and really, most importantly, the people who get the help?
Yeah, that's a great question. You know, I think at the end, what's trying to be achieved here makes a lot of sense. We want to get the most value for the taxpayer dollar. So from my perspective, it's more about the process that's getting us there. Let's find a slow and deliberate process that allows us to identify what is the right interval for redetermination, for example. Let's understand if work requirements really work. And so while we are exploring what works to get that maximum value, let's not leave anybody out during that time period. And so, as I've argued many times, we have a fairly elegant Medicaid program in North Carolina. We put something together that's pretty unique among other Medicaid programs in the country. It's took us a decade to get here. Best thing for us to do is continue to do those things we're doing, test things like we intend to do, look at some of these proposals and do it in a slow, gradual process so that nobody gets lost along the way.
All right, welcome back to Health Matters. Thanks, everybody, for sticking around. We appreciate it. We're going to talk a little bit with Dr. Sanghvi about the Sunbucks program. Tell us what that is.
Yeah, this is a great program. So school's out. And it's summer. Well, almost out. We're almost getting that point, depending on when this airs.
It's been out for a lot of kids already.
Absolutely. And if not, they're at least mentally checked out, right? Yeah. And so we know that there are so many kids who go to school hungry day in and day out. Over 1 million children in North Carolina. And so somewhere around 1.1 million benefit from this program called Sunbucks. And what it basically does is it provides food, lunches, breakfast in some cases, during those summer months when kids can't access what they might otherwise get through schools and other sources. And so it's a fantastic program. It's federally funded. It's administered by the state. When we put a little state money in, we get quite a bit of federal money from it. So it's that nice kind of balance that we have with so many human services programs, where there's a combination of the state and the federal each doing their share. But it's really an opportunity for kids to not go hungry. Here's the fantastically sobering number about that, though, Rod. You know how much it takes to feed a kid for the summer in this program? $120 a child for the entire summer.
For the whole summer?
For the whole summer. So it's a big number. It's over $120 million aggregate program. But when you think about each child, it's $120 per child.
I mean,
per
Dr.
summer.
Dev, people spend that much money on one meal for one person in one night.
You're exactly right. And so I think that's the other thing we really have to appreciate about all these human services and Medicaid. When we talk about them in aggregate numbers, they are big numbers, and it is a daunting task. And I don't envy any lawmaker who needs to think about how we've got to find a way to afford all of these things. But I think we also have to look at it from the bottom-up perspective, where you really have these individuals who the actual amount that is allocated or required by the individual is kind of small.
Yeah, I mean, it's really minuscule. And you reach a lot of children with this program. Was it 1 million kids?
Over 1 million children, yeah. Yeah.
And I guess people forget too that a lot of times during school, those may be the only meals kids get.
Absolutely.
So the summer, it's difficult for them.
Yeah.
Is that program, how's it going? How long has it been around? It's relatively new, right?
It's been around for a couple of years, and we're fortunate that we're going to have it running again this summer. And then, of course, we're in that whole budgeting process now, and at the state level as well as the federal level to see what happens next year. But we're fortunate to know, at least as we get through this summer, the program is funded. Kids are going to get their food and enjoy summer as they should.
Yeah. How do people apply for it?
So we can go to our website to learn more about it, but most of these services are actually offered and enrolled through the counties. So usually through your county DSS, Department of Social Services, individuals can reach out there. There's an eligibility criteria that go along with it. So
I was going to ask, what are the requirements for it?
Yeah, usually you have to demonstrate eligibility through income eligibility and a few other criteria. And it's like any of the other human services programs that we offer. They want to make sure that they're really available to people who really need them most, and so those criteria become important.
Food insecurity is a big deal,
It is.
Especially for children. Talk a little bit about that for me.
Yeah, well, when you think about it, food is expensive, but relative to everything else that we need to keep people healthy, it's not as expensive. And so really investing in healthy and nutritious food, particularly in life, becomes so important, which is why we've do programs like Sunbucks. We've also demonstrated if you tackle food insecurity, you can actually decrease things like inappropriate or otherwise avoidable use of healthcare system. And I'd rather pay for someone to eat than go to the emergency room for something that they really don't need, but became the result of not having access to healthy and nutritious food.
And for kids, if you don't have a good breakfast, you're not getting any energy. That whole day's shot.
Yeah, and I know this gets a little into the public instruction space, but we know that those are the same kids that find it hard to concentrate. Sometimes are those who are seen as not, acting out, which is even a term I don't really like as much, but those are the ones. And so you realize it's so foundational that, there's good science behind it, but you almost don't need science. Common sense also kind of tells you it's the right thing to do.
Yeah, common sense, my friend, I've learned ain't common. And we're talking like 1 in 6 North Carolinas face food insecurity or something
like that.
Lines.
Right, well, 1 in 6 is exactly right, yeah.
So there's still time for families to apply for it, or?
There is.
Okay.
Yeah, I would say go to, start with our website at dhhs.nc.gov, and then you'll get some information from there, and then look to your local county DSS for more information.
All right, last topic.
Let's do it.
We're almost there. I know you're like, is this man ever going to stop?
Oh, no, this is great. I enjoy it.
Let's talk about the new vaccine tool and the provider tool. And you guys launched this recently, right?
Yeah.
Was it like this month or last month?
A couple of days ago. Yeah, so it was this month. Yeah.
Really this month. Okay, so tell me about this vaccine tool and what it is.
So it is a tool. It's called the Vaccine for Children's Program, or and what it really allows you to do is if you go to the website, identify providers that are providing those vaccines that the CDC has recommended for children and teens. And what you can do is if you are not able to access vaccines because you don't have insurance, or you might be Medicaid eligible and you don't have Medicaid, you're able to go to this website and identify providers who are providing these vaccines, and you can get them at no cost.
What vaccines are we talking about?
So these are the vaccines that the Center for Disease Control has identified as being age appropriate. So it depends on what age you are and what might be appropriate. And of course, if you are in a situation where you haven't had a vaccine because you may be delayed, there may be opportunities to catch up on what we call the vaccine schedule. It's a great program. It's a program that allows individuals to remove that barrier of I can't afford it or I don't have the money for it to be able to get the vaccines that they need. So you go to the website, identify who is providing it through the Vaccine for Children's program.
And how will this program, obviously it will, how will it help with the vaccination rates in our country?
Well, the hope is that you get those rates to that critical number that you need. We all became somewhat experts in the terminology during COVID, and so we use words like herd immunity and those sorts of things.
Way too
knowledgeable. I've even caught myself maybe not using them in the most scientifically valid ways. But you really want to get to that critical mass of individuals who are vaccine protected, and so that does a couple of things. Is it prevents the virus from being around in the community, but simultaneously helps those who may not be vaccinated for one reason or another, usually because they haven't hit that age milestone to get the vaccine, or they may have a medical reason why they don't have it. It actually prevents that virus or the illness from being around, and so it protects others as well.
Has the national vaccine tool, the kind of the locator, has that become less reliable?
Not really. I mean, I think the tool that we have in the state is actually pretty reliable, because what we're able to do is if you go to the website, you can actually figure out locally who offers that service for you. And so there's a good way to make sure that you kind of match where you are and what's available in your area.
All right. Anything else you want to tell us about the vaccine tool and how important that is? Or
use it. I mean, if you haven't had your vaccines, go ahead and use it. It's no cost. The vaccines don't cost. There may be some nominal costs associated with administration and so forth, but my experience has been is usually if there's anything, it's nominal or not. But whether we're talking about the MMR and the measles vaccine, as we were talking earlier, or the vaccine for kids program, like we just talked about right now, if you think about it, it's one of the best tools that we have to prevent illness.
anything else coming down the line that health department wants to share with people who are watching?
We started talking about Health Matters and it's summer, and a couple things you got to think about the summer: the heat. So you want to make sure people stay hydrated. If you're going to be out in the sun, sunscreen. There's a lot of debate on the utility and stuff right now, but sunscreens have been proven to be effective in preventing skin cancer and other thermal and heat-related injuries that you might get from the sun. Water, you want to stay cool, but water safety is important as well.
Absolutely.
And then, something we don't think about a whole lot, it's picnic season as well. So make sure you cook your food and you don't store food out in areas where you can promote the growth of bacteria and other pathogens on that food.
All those times between Memorial Day and the 4th of July, we need to think about it too. Exactly. We talk about it a lot on those 2 days because people are, cooking out and having stuff sitting out on the table. I guess working in TV, I've become a little concerned about everything that I read. So I'm very careful at cookouts now. If I see it sitting there too long, I'm like, I ain't fooling with that.
There you go.
And all the food that hits our table in the newsroom, I'm like, nope, too many hands been in there. All right, Dr. Dev, thanks so much. Listen, I appreciate it. Health matters, and we want to keep telling people that. And you guys are doing some great stuff over there, and we appreciate it. And we look forward to our next episode.
Perfect.
And I don't know why I showed that again. That's what I was trying to show.
Perfect.
But thank you so much.
All righty, thanks. Yeah, take care.